Hello everybody, Chris from the Headache and Pain Management Centre here today, and today for your Tuesday I'm talking all about painkillers. And even though it's a little bit controversial, the physio talking about painkillers, given that we see a lot of people with headache, low back pain, migraine, things of that nature that are obviously taking all sorts of painkillers for their pain, I thought it'd be a good time to have a chat about what it's all about. It's equally relevant for me as well. I've actually just been in surgery 5 days ago for operation on my wrist, just taking a little bit of a cyst out of the wrist. So when I was sitting there in recovery, I was actually I actually had some painkillers there and thought, look, it'd be a good topic to talk about given that it's big in the news in the Americas at the moment, the United States. G'day there, nice to see you. And talking about opioid medication, how that's actually affecting people. If you're there, type in underneath and say hello, type in your name. It's good to see that people are having a look at the video, and we'll be talking about opioid medication. So talking about painkillers. So obviously a lot of people that we see take a lot of painkillers, and we get a lot of questions about the types of painkillers, what the good things are and the bad things are about them. And one of the painkillers that's a really common class of drug that people take are called the opioid medications. So those are the sorts of medications that are like Panadine, so codeine, morphine, and even stronger ones where some people are on things like fentanyl, tramadol, things of that nature. So last week when I had my surgery, I was offered a box of tramadol, which I gratefully took because I thought that I might need them, but amazingly I didn't actually need them. I only needed Panadol, and I'll talk more about why that was the case later on. But certainly when it comes to these opioid medications, they're really, really good for acute pain. So for pain where there's tissue damage that's really fresh, okay, so a fresh injury like a gash to the leg, a fresh fracture, something like that, where there's really acute pain, there's actual tissue damage, it's really effective. Now what most people don't know about these opioid medications is that basically that actually targets a part of the brain which you might not expect. Because a lot of people, when they have pain, don't understand or don't realise that there's a whole myriad of different parts of brain matter that light up when you have pain. Quite broadly, what we can say is that there are two parts of the brain that light up. There's a part on the outside, sort of lateral part of your brain, which is responsible for the area of where the pain is, so where does it hurt? And then there's a part on the inside of the brain, right in the middle, which deals with the emotional side of it. So this pain is there and it makes me feel bad or good. Okay, so most people it feels bad, but some people they like the pain, but other people they don't. So obviously you've got these two areas of the brain that are really responsible for how pain is interpreted. Okay, so what the painkillers, like opioid medications, g'day there, nice to see you, type in below and say hello. What it's talking about with these opioid painkillers is that basically it targets the internal, the inside, the medial part of your brain. So it targets the emotional center so it makes you feel good. So when you have a fresh tissue damage like a gashed leg or a break or something like that, what the medication like your morphine, the green stick in the ambulance, these sorts of things are doing is it's actually making you feel better. Okay, so you've got the pain but it doesn't affect me as much is basically what's going on in your mind. Okay, it's what's going on in your brain. So when you have that opioid medication, the pain, the tissue damage is still there, but the pain is not as bad because you're feeling better. There's a rush of opioids rushing through your blood to actually dampen the pain signals or the receptors down from the tissue so it doesn't feel quite as bad. Now, as I mentioned before, these medications are really, really good for acute pain, so for breaks, for fresh injuries. But when it comes to chronic pain, when it comes to chronic migraine, when it comes to chronic back pain or chronic whiplash, what happens is that these medications aren't quite as effective. In fact, they can actually be quite detrimental to your recovery. Because when it comes to chronic pain, it's actually nothing to do with tissue damage when it's there for 3 months or more, but more to do with the sensitization of the tissues, okay? So how sensitive the nerves coming up into your spinal cord, into your brain are, and what the message being spat out from your brain is, and by and large, what you're actually feeling, so the pain that you're feeling. So it's important to separate out that tissue damage and pain are not related. So you can have a huge amount of pain with only a very minimal amount of tissue damage, and you can have a huge amount of tissue damage but no pain. So your brain can actually work in very different ways when it does that. So when it comes to these opioid medications like your fentanyl or morphine or Tramol, these sorts of things, or codeine, quite often what happens is you become addicted to it, because what happens is that the receptors that are in your brain that these drugs are targeting are actually taking more hold of the emotional side of your brain, or the bit of your brain that makes you feel good, as opposed to doing anything to the signals coming into your brain that are causing the pain in the first place. I hope that sort of makes sense. It's a little bit sort of an abstract thing to understand. Type in below if you've got any questions about that. I'm really happy to answer them for you. So when it comes to morphine, when it comes to opioid medications, and heroin is a cousin of those medications, you become addicted to it. And as a result, the addiction, it feeds off and makes your body more and more sensitive. It wants more and more of that hit to become more and more sensitized to it. So what happens from there is that when you have that all sort of going on as far as that's concerned, what happens is that you become addicted to it, and what happens as a society is that you actually have a lot of illnesses and a lot of very bad things that happen as a result of that, and that includes deaths, that includes breaking with families, it includes addictions to other harder drugs as well. So in the United States at the moment, you have a whole swathe of different things happening over there at the moment with opioid medication, and the reason for that is because there's been 30,000 deaths due to opioid medication overdoses, which is absolutely tragic. And the reason why these overdoses happen is because there's a lack of education about why and when opioid medications should be used, and they should only be used in the first week or two after a very acute injury, and not for chronic pain. Unfortunately, what happened about 20, 30 years ago is that these drugs were thought as a panacea. They were thought as this cure-all for all sorts of pain, which worked really, really well for a while. And then all these people got addicted to them. They were very strongly marketed towards unwilling and unwitting sort of doctors about that. And unfortunately, what happened is that all of these people have actually become addicted to these painkillers, which is really, really unfortunate. So when you get addicted to these opioid medications, and you've got a hell of a lot of other people addicted to them as well, what happens, you have this crisis across the medical and the health professions. We've got all these people that are addicted to opioid medications that have got chronic pain, chronic migraine, these sorts of things, and haven't been adequately explained what the problem and why their pain is there in the first place. And if they don't know why the pain's there, it's actually really easy just to go and get a tablet and say, hey, look, this is actually going to make things better, and you get that hit of pain relief. I shouldn't have done that hurt. But it actually doesn't cause a lot of good things in the long term. You become addicted and it becomes a really big crisis. So this is why the Australian government have actually taken codeine from an over-the-counter drug and now made it subscription only, so that doctors are able to sort of talk about the options with patients about pain and what they can do about it to actually make things better. The unfortunate thing is with pain at the moment and pain education is that a lot of people, a lot of physios, doctors, chiros, people who treat pain aren't up to date with the latest in the pain science. And what happens is these well-meaning people are doing outdated treatment techniques, outdated prescribing, and not doing the right thing by their patients. When we now know that teaching someone about their pain, what they can and can't do, that things are safe or things are dangerous depending on the person's condition, having people taking control and taking, if they like, they're empowered more to try things and actually how their pain works. It's actually far, far better for them rather than being reliant on opioid medication and being at risk of being just another statistic about, like in America, where there's been just so many people that have died due to overdoses from painkillers. And that's the sort of thing that we like to do here, is we're liking to educate people about their pain. The reason why people come in about their pain is not because they're in pain. They're coming because they don't know why their pain is there and what they can do about it to fix it. And that's what the two questions that we want to answer with every patient that comes in through the door. So that's pretty much where it's all at the moment with pain medication and pain education. So if you're on opioid medication, talk to your doctor, talk to your pharmacist, talk to your pain specialist about the options there about coming off those medications, especially if you've got a chronic pain condition, and then seek other advice about what else you can do, which are more active ways to make your pain start to become a thing of the past and become less burdensome. For those that are asking in the comments below, basically my surgery, I had the tramadol prescribed to me, but I didn't actually need to take it. I actually just took Panadol. I had a local anaesthetic in the wrist for 24 hours afterwards, which sort of numbed the pain a little bit. And then as the feeling came back, yeah, it's a bit stiff and I can, it's a bit hard to bend and things like that at the moment, but I'm just needing a bit of Panadol to cope with that, because I know that there's some stitches in there, that they've had some surgery, it's relatively minor, and I know it's going to get better in a few weeks or so there's no real need for me to sort of take those opioid medications. So for those who are sending their well wishes, thank you for doing that. I appreciate it. That's it for today. I hope you've got something out of that and learned something. If you'd like to know a little bit more about pain and what we might be able to do to help out and sort of come off opioids and give more active things to do, type in pain education below, and I'm more than happy to send through some information there. And also, if you know anyone who's got who is taking a lot of Panadine at the moment, not sure of what to do next about their headaches, their chronic pain, type in below their name, tag them, like or share, comment. We're more than happy to talk to anyone about pain. We love talking about it, and we love just spreading the word about all the different things that we can do and what you can do to assist your pain journey from there. So type, like, comment, share below, and it's really good to see that there's a couple there that have been through with the video for me the whole time. It's really good to see you there. Thank you for joining in, and thank you for the love react as well. I appreciate that, and I will see you next time that we post a video online, so watch out for that. Thanks very much, and bye for now.